السلام عليكم. محاضرتنا لهذا اليوم Tooth Movement Mechanics. Introduction. A clinician is an engineer. Anyone trying to move teeth requires to use force, and mechanics is the study of the effects of the forces on the body. Hence, knowledge of mechanics is a must for every student of orthodontics. Forces as vectors. Force can be defined as an act upon a body that changes or tends to change the states of rest or of motion of that body. Forces can be represented using vectors. They have specific magnitude and direction. In addition, the points of application must be taken into account and has great significance from an orthodontic perspective. Forces are represented as a vector as they possess both magnitude and direction. The points of application of the force is indicated by the origin of the arrow as shown in this figure, which is at the bracket. This is simply the points of the contacts between the body being moved and the applied force. Direction is indicated by the body of the arrow itself and the arrowhead without the head of the arrow. The body alone indicated the line of action. To understand how a body reacts to more than one force require the creations of the vector diagram. In the simplest scenario, with the points of the application of say two forces being at a common point, the resultant is indicated by the diagonals of the parallelogram drawn using the vectors of the two forces as shown in this figure. When the two forces are acting at two different points on the same body, the parallelogram is drawn by selecting a points of application along the lines of the actions of one of the forces. The line of the action may be extended anywhere of the tooth to construct a totally artificial points of the applications in spaces. Sometimes a single force may be resolved into a component to simplify the study its effects on a particular body. Usually this is done by splitting the forces vectors into two components at the right angles to each others into a vertical and horizontal components. Now force and movements. A center of a resistance. Every unrestrained body has a point of which it can, at a rest, in theory, be perfectly balanced. This point is called the center of gravity. When we talk about teeth, we are talking of a body which is restrained by adjacent structures like periodontal ligaments. For such restrained bodies, the analog points to the centers of the gravity is called the center of resistance. By definition, a force with a line of the action passes through the center of the resistance to produce translation. The center of the resistance of the single-rooted tooth is on a long axis of the tooth, properly between the 1/3 and 1/2 of the tooth length of the root length, apical to the alveolar crest. For the multi-rooted teeth, the center of the resistance is properly between the roots, 1 or 2 millimeter apical to the forcation. In this figure, we can see the center of the resistance of the single-rooted teeth, which is just in the middle, or at the junction between the middle and the apical thirds of the roots, while the center of the resistance in the multi-rooted teeth is located 1 to the 2 millimeter apical to the forcation area. Now, the center of the resistance of the tooth varies with first, root length, second, alveolar body length, third, the root morphology, single or multi-rooted teeth. The tooth movement resulting from a force delivered at the bracket depends upon the resistance of the line of the action of the force from the center of the resistance. Identical force applied to the teeth with the different root length or brackets placed at the different height can have a different effects. Also, the movement of the teeth in the adults with the alveolar bone loss would be different than in adolescents. So in these figures, we can see the changes that occurs in the center of the resistance of the tooth, that's allowing the alveolar bone loss. So when we have the loss of the bone, so the center of the resistance of the tooth will be moved more apically. Second, we have the types of the tooth movements. A tooth can be moved in one of the three ways. First, translation or bodily movements occurs when all points on the tooth moved unequal distance in the some directions. Translation occurs when the line of the action of an applied force passes through the center of the resistance of the tooth. The tooth responds with a pure bodily movements in the directions of the lines of the actions of the applied forces. Pure translator movements are seen during orthodontic extrusion or intrusion, or bodily movements during retractions or protractions of the teeth. True translation movements are difficult to achieve under clinical circumstances, even though they remain the ultimate goal of every clinician. Second, we have pure rotation. Pure rotation is said to take place when there is a movement of the points of a tooth along the arc of the circle, with the center of the resistance being the center of the circle. During orthodontic tooth movements, the rotations can be of two types. First, we have transverse rotations in which the angulation of the long axis of the tooth changes. Example, crown tippings or root torquing. Second, we have a long axis rotation. The rotation takes place on the long axis of the tooth. The angulations of the long axis of the tooth remain unaltered. In this figure, we can see the concept of the centers of rotation can be used to define any types of the tooth movements in any planes of the space. Any movement is that not pure translation or rotation can be described as a combination of these two forms of the movements. Moment of force. When the line of the action of the applied force does not pass through the center of the resistance, the force will produce some rotation. The potential for the rotation is measured as a moment. The magnitude of the moment is equal to the magnitude of the force multiplied by the perpendicular distance of the line of the actions of the force to the center of the resistance. As shown in these figures, we can see the centers of the resistance and the applied force on the crown of the teeth. So in order to measure the moment of the force, we can multiply the amount of the force that's applied on the crown of the teeth multiplied by the distance from the point of the force applications to the center of the resistance. Hence, the moments of the force can be altered by changing the magnitude of the force or by changing the perpendicular distance of the line of the actions of the force to the center of the resistance. Hence, if the magnitude of the moment need to be decreased, the force can be applied closer to the center of the resistance of the tooth. If the line of the action of the force does not pass through the center of the resistance of the tooth, the moment is necessarily created. Third, we have a combined rotation and translation. Whenever a force is applied to the tooth which does not pass through the center of the resistance, it will cause a movement of the tooth in the center of the resistance will translate as if the force does not pass through it, but the tooth will also rotate, since the applied force produces moments above the center of the resistance. The result is a combination of translation and rotation. Now, a couple consists of the two forces of the equal magnitude but opposite in a direction, with a parallel but no collinear lines of the actions. When two forces are applied in this manner, the resultant produce in a pure movement. The translatory effects of the individual force get cancelled. The center of the rotation is a point around which the rotation actually occurs. When an object is being moved or rotated, the center of the rotations can be at any positions of the tooth. So in these figures on the left side, we can see the centers of the rotation outside of the tooth during the extrusion and intrusion of the tooth movements. So in these figures on the right side, we can see transverse rotation with the center of the rotations at a tooth. Firstly, A at the crown tip, P at the root apex, C at the some distance from root apex. As the centers of the rotations moves toward the apex, the more the displacements of the crown and vice versa. The actual movements of the tooth does involve a series of changing centers of rotation. Theoretically, a single force plus a single couples can produce any types of the tooth movement. This may sound very simple, but is extremely difficult to achieve clinically to produce only bodily movements. The force system at the brackets must be equivalent to the force with no couples at the centers of the resistance. Rates of the tooth movement. We have a normal rate of the tooth movement is about 1 millimeters per month. Now the factors will affecting the rates of the tooth movement. First, the force magnitude and the direction. Second, shape and numbers of the roots of a moved tooth. Hence, surface of area required a higher amount of force. Third, bone quality and density. Fourth, age of the patient. A certain force that produces tooth movement is in adolescents, so produce less tooth movements in the adults. These figures can be seen the amounts of the force required for each types of the tooth movements. So we have a tipping, we need from the 35 to the 60 grams. In body movement, we have need a 70 to the 120. Root brightening from the 50 to the from 50 to the 100. Rotation from the 35 to the 60. Extrusion between 35 to the 60. In intrusion, we need 10 to the 20 grams. And thank you for your attention.